We cried a lot that first year. We cried a lot.
I'm very fortunate to be able to look into my mama's eyes and look at her with a different love.
It is immeasurable, the gratitude that we have for our caregivers.
It is not an easy fact to accept. You either already are or will likely become one of the millions of Texans who are caregivers for a sick or elderly family member. The focus often on the patient. The caregiver and their enormous tasks are rarely seen or acknowledged, forcing them into isolation, depression, and health deterioration. So what help do they need? What gaps in the system are holding them hostage? And what support can they access at any time? Solutionaries works to answer those questions.
There was an overwhelming amount of emotions.
We cried a lot that first year. We cried a lot.
I had to retire my job of 34 years.
Their loved ones' diseases, ages, and outcomes are different, but the words these caregivers use to describe their experiences are so similar.
We've been married 46 years.
Jim Calhoun's wife, Pam, was diagnosed with Alzheimer's 12 years ago. While she still interacts with people. Thank you. Red is my favorite. How did you know, Pam? Red is my favorite. But she cannot have full conversations.
We're just eating Skittles.
He felt alone, exhausted, and depressed until he reached out to the Alzheimer's Association, which led him to a support group.
This past 6-7 months, it's been hell. I'm not gonna lie.
They even gave him advice when he made the gut-wrenching decision to move his wife to a memory care center.
It was really awful, but and I said I couldn't go through this.
That's because he was advised to do his homework and visited 5 centers multiple times before choosing the landing at Stone Oak. And he says Pam is doing great there.
Let me see. Is it good?
The big issue he sees is with insurance coverage.
We need insurance companies to allow us to pay for this type of care.
For other dementia caregivers, even if they did have insurance, they're not really open to the idea of nursing homes.
Mama, I love you. So then she says, I love you back. Night, okay?
Minerva Longoria's 92-year-old mother, Minnie, was diagnosed with dementia 4 years ago. And when she looked for care facilities, she wasn't happy with what she saw.
The short staff and also COVID going around, flu. It's also fear of the caregiving quality in the nursing homes.
That's why she's thrilled to see House Bill 1673 just passed in Texas, which requires more training for residential center employees to improve the quality of care. In Texas, there are 1.5 million dementia caregivers that provide over $24 billion in unpaid care. Longoria could have been one of them, but found out that she could get paid for caregiving. But that income is just $10.60 an hour with no benefits.
They should definitely be paid more.
Ginny Funk has been a caregiver, but is also the director of programs for the Alzheimer's Association South Texas chapter.
We refer to the Area Agency on Aging quite a lot. They get Older Americans Act funding that helps pay for some short-term respite, caregiving in the home.
And more progress is happening right now. The 2024-2025 state budget directed $5.5 million over the next 2 years to the Texas Department of State Health Services Alzheimer's Disease Program, which includes services for caregivers. Another expensive and long-term disease is ALS.
Being given a terminal diagnosis is shattering through the soul.
Juan Reyes got his full ALS diagnosis in 2015. The only thing Juan can move is one finger, meaning he needs 24/7 care.
We have our morning routine, and then I get him dressed. There's days we shower him, there's days we sponge bath him and get him dressed.
Juan's wife, Meg, has been a constant, unwavering support system. She's developed that confidence with constant involvement in the ALS Association and a number of support groups.
I work through IMALS. We have a mentor program.
Since Juan is a veteran, Meg has been asked to help set up a general caregiver support group at the VA. But that's just the tip of the iceberg when it comes to the couple's involvement in furthering resources for families battling ALS. They constantly travel around the country advocating, including multiple trips to D.C. and the White House.
I think the biggest gap is the cost and not enough quality candidates out there. But if you work with a company that has caregivers, There's certain limitations, like if you want someone that's going to transport you, it's going to cost you more.
So Juan and Meg use their voices, and their voices are not quiet.
You have to be your own advocate sometimes.
Texas has the second largest population of ALS caregivers at 2.1 million. And the ALS Association Caregiver Needs Survey showed the most needed care programs are home visits and equipment loan programs.
There is no national network that anyone can tap to find the equipment.
That's why Meg and Juan are part of a grassroots effort in South Texas to coordinate equipment swaps between families. The diseases of ALS and Alzheimer's have in common the age of patients, typically older, while other diseases like cancer can leave patients caregiving for their younger kids. 10-year-old Charlotte Pollock is now a cancer survivor, but that's not what defines her.
Volleyball and playing with my friends.
But cancer did dominate her life for years, starting at the age of 9 months.
We found the first tumor on her adrenal gland, and they were able to remove that and no treatment was necessary.
But that cancer led to a more devastating diagnosis called Li-Fraumeni syndrome.
She's predisposed to cancer more so than other people would be.
And at 3 years old, they found a brain tumor, which required surgery and 18 months of chemo. This Zoom interview with Katie at home and Ryan at work as a firefighter, a realistic look into the family's divide and conquer attitude. They say they owe their success to their family, community, and to the American Cancer Society, all stepping in to guide them towards resources.
There's groups for everything on Facebook.
I've been a caregiver. I lost my mother in 1998 to breast cancer.
That's what led Jeff Bayless to become the executive director of the American Cancer Society South Region, offering services he wants families to know about. That includes a 24/7 care line, and they even just launched a new app called ACS Cares, a patient and caregiver support system right on your phone.
Well, you can call us in terms of transportation to get someone to treatment, lodging if you're being treated out of town. Our advocacy team is, at the federal level and in every state house, constantly trying to remove barriers to get navigation covered by insurance.
Navigation basically means caseworkers that help guide families through the complicated process.
This is something we'll do for the rest of her life. She'll have head-to-toe annual MRIs every 3 months.
If they have to face it again, they'll know where to turn.
I even have a memory of my dad sleeping on the bench one night.
It's the essential tool for all caregivers to give care while also setting themselves free.
I'm very fortunate to be able to look into my mama's eyes and look at her with a different love.
But in the end, the most important thing they all have in common is that under all the heartache and stress is unwavering love.
It is immeasurable, the gratitude that we have for our caregivers.
For Solutionaries, I'm Courtney Friedman.
Be sure to subscribe to Solutionaries to see all our latest videos right here on YouTube.